Welcome to On the Spot Video, where we keep you up to date with information regarding the questions that you ask. I want to start off today talking about the President's Award grant of $250,000. We've received over 100 suggestions and 70 ideas on how we could possibly use this money to improve our patient experience. We've made two decisions so far in regards to using that money. One is to support the emergency department with their patient flow and improved customer service project. And the other one will be to provide support for outpatient surgery and the operating room to upgrade and enhance the family waiting areas. There may be some additional money, so we'll wait and see what the final balance is that's left over from these two projects to possibly consider other ideas. Thanks everyone though for the great suggestions. It was very exciting, and I wish it were $2 million because I think we could have spent all of it on the suggestions that we received. So Sean, how about questions for this time?
Yes, our first question is it possible to get an ATM machine in our hospital? Many families have asked if we have one.
An ATM machine, this is actually a follow-up. It's been asked several times, and the very first On the Spot we talked about the ATM machine. And we have followed up and done research. There's two things I'd like to emphasize. One is that we are working on implementing a debit card capability in our cafeteria. I think that will be a big help. We already have debit card capability in the gift shop. We're also working on the ATM machine, and finance right now is waiting to get some final details from banks regarding the requirements in that regard. So both of those have been followed up, and thanks again for your question.
Mike, our next question was about the Roseland Health Fair in March. What is SMCSR doing to be involved in our local communities to provide access to healthcare to the poorest populations?
We do a wide variety of work to reach the marginalized and the poor. We were not involved in the Roseland Health Fair, and we are actively involved in the Latino Health Forum coming up in October. Additionally, we've just provided over $100,000 of grants to the community clinics, which are the front line of primary care to the poor and marginalized. We also, through our hospital services, especially the emergency department, provide millions of dollars a year of free care to those in need. So this is something we care about. We're glad you're interested, and please be assured we reach out in many ways to these marginalized groups.
Mike, the next question addressed customer service training. Can we get this kind of training for new employees or employees that are new to the field, speaking to patients, learning appropriate etiquette, and handling problems?
Well, on our dashboard that we use to measure our performance, patient satisfaction and service are a major part of that. And this is an area where we want to invest. Currently, we have a team looking at our employee orientation process and program, and they're looking at some recommendations on how to intensify training in the orientation so that new employees are brought in with a thorough training regarding the behavioral expectations of Sutter Medical Center Santa Rosa, and how to use the skillful interchange with patients when they're rounding with patients and when they're doing service recovery with patients and families. So great point, and yes, we are investing in this particular area of service. Once again, we had many more questions than what we have time to answer in this On the Spot video. So look in the grapevine coming out and you can see the written responses to many other questions. I also want to touch on a couple other important things, very exciting things. Our new hospital plan is moving along, and if you didn't hear it at the FYI forum, understand that we've created a plan now where we've kind of brought the two separate hospitals into one design, and we're moving this plan forward through the approvals of the Board of Supervisors with the game plan of starting construction by October. So that's all moving along. Things are very, very much in the final stages of the planning process, and it's also very exciting. And a second thing is to understand that we continue to have some solid, sound financial performance in our hospital. 5 continuous months now of positive net income. Not huge numbers, but it's very encouraging because we need that money to pay the mortgage on the new hospital. So thanks for your hard work, thanks for your great service, because it's a team effort, and if it wasn't for the efforts that you make out there with our patients and customers every day, those great results wouldn't happen. So thanks a lot.